Hi, my name is Amanda. I'm a physician assistant with Care Pediatrics, and I wanted to take some time today to talk about the myths that we hear often from parents in the clinic surrounding fevers. We have parents that are worried that a fever is bad, I have to treat the fever, fever needs to go away. The reality is a fever is just the body's way of helping to fight off a virus or a bacteria. It's a natural defense mechanism to raise that body temperature and give our immune system an advantage over to the very sensitive, heat-sensitive virus or bacteria that is trying to fight it. Another myth related to that, our second myth, is going to be fevers can cause brain damage. While there is a grain of truth in there, the reality is a fever in a kid is highly unlikely to go over 105 degrees. Brain damage doesn't occur until almost 108. Close to 108 is where we see brain damage. So as long as we're staying far away from that 108 number, then there is no risk for brain damage from a fever itself. Number 3 myth that we hear is that fevers need to be treated, is that anything up to 100.4 degrees is an elevated body temperature. Lots of things can raise our body temperature. It could be teething. It could be that we ran really fast. And so anything between 100.4 degrees and 104 degrees is the kind of range where we want to take a look at the kid. If the kid is lethargic, in a lot of pain, isn't able to keep fluids down, then we want to treat that fever because likely the pain and the discomfort from the fever itself is the thing that's preventing our kid from being able to do things like get enough fluids to help them fight the virus. However, if your kid is active, playing, taking in enough fluids, even if they don't want to eat very much, that's okay, but the fluids is the important part. But the thermometer reads at 102, we don't actually have to treat that fever just for the sake of treating a fever. The last myth is that treating a fever is going to make the infection go away faster. If I can get rid of this fever, then obviously my kid's going to get better faster. Unfortunately, that's not the case. We don't have any evidence that treating a fever slows down the rate of recovery when it comes to an infection either. So treating the fever is going to allow your child to be more comfortable, but it's not going to make the infection go away faster. The immune system is going to do its job, and then if we need help from things like antibiotics, then the medication is going to do their job. But treating the fever is not going to speed up the healing process. Hope you all have a great day, and we would be happy to see your child at WeCare if you need help figuring out how to treat your kiddo or help them feel better when they're fighting off an infection.